Have you ever heard of tuberculosis? You may know of tuberculosis as a respiratory illness common in some areas throughout the world. Tuberculosis is a bacterial pathogen with its formal name being Mycobacterium tuberculosis. Tuberculosis is commonly known as TB. TB causes chronic inflammation of the lungs, which can lead to necrosis, which is tissue death, or lung tissue fibrosis, which is tissue scarring. Fibrosis and necrosis are both obstruct the airway and airflow to the lungs.
TB is a gram-positive bacillus bacteria. TB is an airborne disease that is transmitted through the air when an infected person speaks, breathes, or coughs. Someone else then breathes in the TB bacteria, and the TB bacteria grow and attack their lungs. The bacteria often spread to other parts of the body via the blood. Most often, TB travels to the spine, liver, and kidneys.
Tuberculosis in humans can exist in two forms: latent TB infection and active TB disease. A person who has a latent TB infection is asymptomatic and cannot spread the infection to others. A latent TB infection can be indicated by a positive skin test or blood test. A TB infection can then lead to TB disease, which can show symptoms such as fever, coughing for 3 or more weeks, or coughing up blood, and chest pain. People with TB disease can spread the disease to others and can be indicated by a skin test, blood test, or abnormal chest X-ray.
Along the airway is the respiratory mucosa, which consists of a layer of epithelium, the lamina propria, a layer of connective tissue and immune cells, and a coating of airway surface liquid, which contains mucus. Along the airways are nasal-associated lymphoid tissues that are crucial for MTB antigen sampling. AECs can recognize pathogen-associated molecular patterns present on MTB surfaces as they express pattern recognition receptors such as toll-like receptors. The first line of defense is the epithelium, which prevents TB from coming into the body. If TB does enter the body, it gets caught in the mucus and is removed from coughing or sneezing. TB that passes through the airway in the first line of defense will end up in the alveoli. The alveoli consists of a thin lining of type 1 and type 2 epithelial cells and alveolar macrophages, dendritic cells, and neutrophils. Macrophages will also be going around in the blood to find any of the MTB and stop it from spreading. Type 2 cells produce and secrete pulmonary surfactant, hydrolytic enzymes, and hydrolases in the extracellular lining of the lung. Dendritic cells are also one of the first types of cells to encounter MTB. They have a multitude of receptors to detect MTB. After stimulation with MTB, neutrophils secrete chemokines and pro-inflammatory cytokines, leading to recruitment and activation of other immune cells. Natural killer cells can lyse macrophages that are infected with TB through receptor molecules NKp44 and NKp46.
Tuberculosis can evade the immune system by growing and reproducing in cells rather than being destroyed. After being engulfed by neutrophils or macrophages, TB can block diffusion with lysosomes, allowing the bacteria to persist. When the innate system fails, the primary adaptive response is activated. Antigen-presenting cells, such as dendritic cells, travel to the lymph nodes carrying the bacteria. After an antigen-presenting cell engulfs a bacteria, it displays a fragment of the antigen complex with a major histocompatibility complex class II molecule, or MHC2 for short. The dendritic cell presents the antigen fragment to a helper T cell, a type of T lymphocyte that can recognize the MHC2 molecule and bind to it with the assistance of a CD4 binding protein. This binding will activate the helper T cell, leading to two types of responses. One response that the helper T activates is the T cell response. In this response, the helper T cell becomes a more specialized form of a helper T cell called a Th1 cell, which releases the cytokine interferon gamma, or IFN gamma, which will activate the macrophages. Similar to the innate immunity, these macrophages will engulf and destroy the bacteria, but these new macrophages are more aggressive than the ones in innate immunity. More stimulation by IFN gamma converts active macrophages to epithelioid macrophages, which create granuloma to wall off the infection in the lungs. The granuloma surrounds the bacteria with the epithelioid macrophages, lymphocytes, and fibroblasts. The epithelioid macrophages secrete 1-alpha hydroxylase, which leads to the calcification of the granulomas. This calcification can prevent bacteria from spreading and can also form a Ghosn complex shown on a chest X-ray, which is an indicator of the disease. The helper T cell mentioned earlier can also activate a B cell response. After the dendritic cell presents the antigen fragment to the helper T cells will bear receptors for the antigen fragment. When a B cell that has receptors for the same antigen internalizes the antigen, it will degrade the antigen and will display a fragment with an MHC2 molecule. With the aid of cytokines and CD4, the helper T cell will bind to and activate the B cell. The activated B cell will then proliferate and differentiate into memory B cells and antigen-secreting plasma cells. The secreted antibodies are a soluble, unattached form of the B cell receptor specific to the antigen. Antibodies can work by opsonization, in which the antibodies present a recognizable structure to promote phagocytosis by macrophages and neutrophils. Antibodies can also form a membrane attack complex that forms pores in the membrane of a cell, which will cause the bacteria to swell and burst. The memory B cells can later initiate the secondary immune response if needed, if the person is exposed to the antigen at a later date.
The secondary response is very similar to the primary response, but the immune system is faster at responding to the pathogen. When a person has been previously infected by TB, they still maintain their memory T cells and memory B cells. Therefore, the immune system already has the mechanisms of an immune response ready for the second exposure to the pathogen. This graph illustrates the difference between the antibody concentration of the immune responses over time. With the first exposure, there are less antibodies produced over a longer amount of time than the secondary exposure, in which a large amount of antibodies are produced in a short amount of time. This is what makes the secondary response so important. Not only do our cells remember the pathogen, but the memory cells are long-lived and provide a rapid response when we are affected again that is almost identical to the primary response. The body gets better at responding to pathogens such as TB over the course of more infections, which can reduce the overall damage to the body and lower the likelihood of death from certain pathogens. Currently, there is a vaccine for TB called the Bacillus calmette-Heron vaccine. The BCG vaccine is a live attenuated vaccine that is more general to Mycobacterium than it is specific to TB, so it can also be used to treat leprosy. The vaccine has a live attenuated version of Mycobacterium bovis to trigger an immune response without exposure to the wild pathogen. The main groups that are prioritized to receive this vaccine are children, citizens in developing countries, and those who are exposed to multi-drug resistant tuberculosis. TB mainly affects residents of Southeast Asian countries, African regions, and Western Pacific regions. This trend is likely due to limited access to healthcare and antibiotics. Additionally, TB is resistant to many antibiotics due to people not finishing the full course of their antibiotics, doctors prescribing the antibiotic when unnecessary, and poor quality antibiotics. Overall, there has been less reactivity in a tuberculosis skin test when the patient has been treated with the vaccine, so the BCG vaccine is a viable option for many risk groups.
We created this video using information from the Wiley Online Library, the National Library of Medicine, and the Centers for Disease Control and Prevention. Thanks for watching.